Hi, my name is APeralta, and I am the caseworker assigned to Miss Georgia. Miss Georgia is a current resident of an independent living community, where she has lived now for 2 years. A staff member from her community has recently noticed that she has been missing her noon meals now for quite a few days. Another staff member has also brought to my attention that her front door was left open just a few days ago. Although these may not seem like important concerns, for people at Miss Georgia's age, they can be early symptoms of several conditions. For this reason, I put a referral in for Miss Georgia to have a medical checkup. Her medical checkup came back fairly normal. Besides arthritis and blood pressure, which she already takes medication for, her physical was all clear. Miss Georgia is very fortunate to have family relatively close to her. Every weekend, we can expect her to have at least one visitor. This past weekend, Miss Georgia's grandson, Jack, stopped by to inform me that during their visit, his grandmother referred to him as David, his father's name. I know what you're thinking. Everyone slips up sometimes. Just a simple mistake. Unfortunately, this makes the third occurrence of lapse in memory for Miss Georgia. Taking into account all three occurrences, I believe that Miss Georgia may be suffering with a condition within the category of dementia. Dementia is defined as a deterioration of cognitive abilities to the point that functioning becomes impaired. There are several disorders that fall into the category of dementia, such as Alzheimer's disease, behavioral variant frontotemporal dementia, vascular dementia with Lewy bodies, and Huntington's disease. I believe that Miss Georgia is displaying early symptoms of Alzheimer's disease. According to the Alzheimer's Association, an estimated 6.5 million Americans aged 65 and older are living with Alzheimer's in 2002. Alzheimer's disease does not appear suddenly and in full force. It can actually begin very mildly and usually begins with memory loss. These mild initial symptoms are referred to as mild cognitive impairment, MCI. In Miss Georgia's case, forgetting noon meals for an extended period of time, leaving her front door open, and forgetting her grandson's name are all forms of MCI. Because so far these are the only symptoms that Miss Georgia is displaying, I can assume that she's in the very early stages of Alzheimer's. As the disease progresses, more symptoms will arise. These include apathy, depression, and disorientation. Some patients dealing with Alzheimer's may also experience a decline in language skills, spatial awareness, and social involvement. Alzheimer's is the deterioration of the brain to the point of death. For someone with Alzheimer's, as the illness progresses, more and more neurons in their brain dies. As that occurs, the brain shrinks. According to our text, 25% of individuals diagnosed with Alzheimer's also suffer from motor decline. Although this disease is not directly genetic, those with a family member diagnosed with Alzheimer's are at a higher risk of developing it themselves. Alzheimer's is a very difficult diagnosis to receive, as it not only affects the individual, but the family as well. While the diagnosed is the one who will forget who they are or where they live, or will lose their ability to communicate or perform basic bodily functions, it is their support system that has to protect and care for them during this difficult and long battle. Many patients with Alzheimer's become aggressive and uncontrollable, making caring for them a full-time job. Although there is no cure for Alzheimer's, treatment includes supportive psychotherapy, which aims to educate the family of the illness, what to expect, and how to care for the individual. This is the first recommendation I would make for Miss Georgia. One way to help in the early stages is to use behavioral approaches, such as external memory aids like lists or visual notes. Another helpful approach is increasing the use of music or pleasant and engaging activities to help combat agitation and disruptive episodes. This is referred to as behavioral activation. Some studies have shown that there are a few ways to help prevent early onset Alzheimer's. Taking care of your physical and mental health at a younger age is the biggest way to decrease your chances of this diagnosis. Taking good care of your cardiovascular system, for example, has been shown to decrease the risk. According to the Alzheimer's Association, 80% of individuals with Alzheimer's disease also have cardiovascular disease. Alzheimer's is a widespread illness that touches everyone. Seeing a loved one transition from not knowing who they are to becoming a different person, to lastly becoming a shell of a person, is heartbreaking and withering process. For this reason, it is imperative to help spread awareness of the many simple ways to help prevent the disease and to help support funding for Alzheimer's research and the development of treatment options. Hopefully one day we can live in a world without this horrible disease.